Good day, we are the group 1. We're going to present the definitions of infections, carrier, communicable disease, infectious disease, and the disinfection. First, infection. Infection, the invasion and growth of germs in the body. The germs may be bacteria, viruses, yeast, fungi, or other microorganisms. Infection can begin anywhere in the body and may spread all through it. An infection can cause fever and other health problems depending on where it occurs in the body. In first, an infection occurs when another organisms enters to our body and cause disease. The organisms that cause infections are very diverse and can include things like viruses, bacteria, fungi, and parasites. Know the signs of infections: fever, chills and sweats, change in cough or a new cough, sore throat or new mouth sore, shortness of breath, burning or pain with urination. Types of infection. First is the viral infection. Vi- it is a virus that can cause a wide range of infectious diseases. It can cause illness by killing cells or interfering with cell function. The virus infiltrates a host body and attaches itself to a cell, where it releases its genetic material. The viruses multiplies as the cell replicates. When a cell dies, more viruses are released and it infects new cells. Some viruses alter the function of cells rather than killing them. Example nito is the COVID-19 na mabilis kumalat sa ating bansa noong panahong 2019 at hanggang ngayon. Next is the bacterial infection. Just like a viral infection, it can cause a wide range infectious diseases such as strep throat, urinary tract infections or UTI, meningitis, and tuberculosis. Bacteria can enter the body through our wounds, scrapes, and surgical incisions, as well as the mouth and nose. Some bacteria multiplies quickly that they crowd out host tissues, asiraan ng normal function ng ating katawan. Some may kill cells and tissues right after they multiply. Sometimes these produce toxins that can paralyze, destroy cells, or trigger a massive immune response that is toxic in our body. Antibiotics are the first line defense against bacterial infections. Next is the parasitic infections. Protozoa are a type of parasite that thrive on moisture and frequently spread disease via water. Some protozoa cause intestinal infections, resulting in diarrhea, nausea, and stomach upset. Oral rehydration therapy is usually the first line treatment. Antiparasitic drugs with a broad spectrum of action can be used to treat severe cases, and also infected people are treated with a combination of antibiotics and antifungal medications. Next is the fungal infection. Fungal infections are often more bothersome than dangerous. However, some can cause serious illness. Inhaling fungal spores is one of the most common ways for an internal fungal infection to develop. Fungal spores are frequently found in decaying vegetation or on animal feces. Fungal cells can invade the healthy tissues and disrupt their function. The body often launches an immune response against fungal particles, which can cause collateral damage to the cells. And last, prion disease. A prion actually isn't an organism at all. It is a protein. Prions can affect normal body proteins and cause them to fall into abnormal shapes. They can cause development of dementia and difficulties walking or speaking, and these diseases are very rare. While some conditions are inherited, others can be acquired. through consuming contaminated food and are considered infectious. Example includes variant Creutzfeldt Jakob disease or a mad cow disease.
Carrier. It is defined as a person or animal that harbors a specific infectious agent without a discernible clinical disease and serves as a potential source of infection. Types of carrier. Asymptomatic carrier. An asymptomatic carrier is a person or other organism that has become infected with a pathogen but that displays no signs or symptoms. Although unaffected by the pathogen, carriers can transmit it to others or develop symptoms in later stages of the disease. In short, asymptomatic carriers are infected with a certain disease but shows no signs and symptoms, however, can transmit the infection to other people. Convalescent carriers. These carriers are those who have recovered from their illness but remain capable of transmitting it to others. It is because these carriers still need more time to rest before achieving full recovery. Incubatory carriers. These are those who can transmit the agent during the incubation period before clinical illness begins. These carriers harbor and transmit the disease to other people just before the disease is detected clinically but has nurtured in the carrier's body already. Transient carriers, commonly known as temporary, are those who shed infectious disease for short periods of time. They pass on the contamination of the disease without it colonizing the body of the carrier as it leaves within 12 to 24 hours. Chronic carriers. These type of carriers are those who have the disease for a longer period of time. The longer the carrier state, the greater risk for the community. They continue to harbor the pathogen or infectious agent for an indefinite period.
For the third definition is communicable disease. Communicable disease is any disease that spreads from one host to another and is caused by an infectious agent that is transmitted from one source to susceptible host. It's either directly or indirect contact. It is often described as contagious or infectious. A communicable disease can travel as a pathogen through one out of five ways: bacteria, virus, fungus, protozoa, or rickettsia. Some of the examples of communicable disease are chickenpox, measles, genital herpes, typhoid fever, COVID-19, and tuberculosis. Sa pinakamadaling paraan para malaman kung ano ang meaning ng communicable disease, ito ay mga sakit kung saan pwede kang mahawa through skin-to-skin contact or by saliva or by the things na tinatouch nung person na infected. Ang pinakamagandang example para sa communicable disease ngayon ay ang COVID-19, kung saan kailangan talaga nating magsuot ng face mask at palaging maghugas ng kamay para hindi tayo mahawaan. Kasi hindi natin malalaman kung may COVID-19 na tayo. Minsan, ito ay asymptomatic at pwede din itong maging severe. Next.
In fourth definition, infectious disease are diseases that are caused by organisms such as bacteria, viruses, fungi, and parasites. All contagious disease are infectious disease, but not all infectious disease are contagious disease. Some example of infectious disease that are not contagious, like malaria and tetanus. Tetanus needs to get into your bloodstream through a cut by a rusty nail, where the tetanus causing bacteria can breed. You cannot get infected by tetanus by being in contact with an infected person. Next po.
For the last definition is disinfection. Disinfection is the process of cleaning something, especially with a chemical, in order to destroy a bacteria. The two methods of disinfection is known as chemical and physical method. Chemical method, of course, is known to use chemical agents, while physical method uses physical agents. Historically, the most widely used chemical agents is chlorine. For the purpose of disinfection, disinfecting uses chemicals or disinfectants to kill germs on surfaces and objects. Some common disinfectants are bleach and alcohol solutions. You usually need to leave the disinfectant on the surface and objects for a certain period of time to kill the germs. For the disinfecting agent examples, these include alcohols, chlorine and chlorine compounds, formaldehyde, glutaraldehyde or tophthaldehyde, hydrogen peroxide, iodophores, peracetic acid, phenolics, and quaternary ammonium compounds.